This is the New York Living Health Report.
While most people are looking for new ways to burn off fat, some New Yorkers are having fat put into their bodies. New York 1 health reporter Cheryl Wills explains why.
David Ramoy is trying to get rid of the scars on his cheeks that were caused by severe acne. He does not want to go under the knife, so his dermatologist, Dr. Kling, is smoothing out the scars by using Ramoy's own fat. The procedure is called fat transfer.
One of the reasons why people began doing fat transfer is after liposuction, instead of just discarding all the fat, we were reusing it and recycling it.
Ramoy did not need liposuction, so Dr. Kling removed a little fat from his waist.
So we took some from the love handles here.
After applying a topical anesthetic to the face, Dr. Kling injects small amounts of fat under the depressions in Ramoy's cheeks.
I withdraw to just make sure that there aren't any, we're not going into any vessels here.
The needle may look intimidating, but Ramoy says it's not painful because the anesthetic numbs his cheeks. Ramoy also noticed a gradual improvement.
There was hardly any scarring. Like, I used to have lines here, they're gone.
Dr. Kling processes his patient's fat and freezes it for up to a year. He says in many cases it works better than collagen.
Collagen can't do very much if you're trying to build up the cheekbones or take away those pouches on the side of the, on the face, which tend to sink in over age.
And that's why Maxine Shepperton gets fat transfers.
I think just to have some fullness and a little bit of that vitality restored.
Dr. Kling says about half of the fat that's injected into the face will be permanent. But this is not one-stop shopping. Patients will need more fat injections every 1 to 2 months. That's because the other half of the fat is reabsorbed into the body. And Dr. Kling says there are minimal side effects.
Fat injections you don't have, and you do not see rejection because it's your own fat. The main side effect is some bruising where the needle goes in and some swelling, which tends to go down gradually over time.
Fat transfers are ideal for non-smokers between the ages of 35 and 60 who have no sun damage to the face. And for most people, body fat is pretty easy to come by, not to mention a couple of $100s cheaper. In Manhattan, Cheryl Wills, New York 1.